You know who you can ask. And we're going to go to a word from our sponsor, the man with the, I think a platinum voice is really.
Is that where we're going? Platinum, okay.
Yeah, platinum voice. I think we have a platinum voice today.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
Hey, we're back.
Hi.
We're back, and we're live, and we're back, and you can call us at 800-848-9222, 800-848-9222. So I have an interesting report about babies. So we're talking about how to make babies, right?
Right.
So the listeners, if you missed the first half of our show, you probably don't know how to make babies. But in the second half of the show, you may have already had a baby. And where do you want to go to deliver your baby? Well, there's a new study out. It was in Bloomberg from January 17. So this is new news.
This was
right?
Yesterday.
Right, it's new news.
Yeah.
And what is this study about? Well, believe it or not, the cost of having a baby in a hospital can vary tenfold. Now, what's tenfold? That's 1,000%, right?
Exactly, yep.
It's 1,000%. Okay, and to quote them, the cost of giving birth at a hospital can vary by tens of thousands of dollars, a price range that is random and unexplainable by market forces. Okay, so the vaginal delivery, we know what that is, a normal vaginal delivery in most populated U.S. state, California, ranged from $3,000 to $37,000. Okay.
Wow.
Okay. Now, when it costs vary that much, now someone's paying the bill, and if you have insurance, maybe you have a maximum amount you can pay.
Right.
Maybe you have to pay 20% copay.
Sure.
Right. So if you go to one hospital and it's the lowest was $3,200. Having a baby, $3,200. Okay. The most expensive in California, $37,000. And don't think California is different, because hold on to your hat.
I'm
but
not wearing one, but
for a cesarean section means they open up the abdomen, open up the uterus, and pull the baby out
and
directly.
sew back up.
Probably, as we all know, C-section.
C-section, right. You
Right.
know C-section. So the range of cost of C-section was $8,000 to $70,000.
Twice as much.
Now imagine twice as much, 10 times. 8,000 to 70,000.
Compared to the other delivery, it's more than twice
Yeah,
as
but
much.
it ranges up to $70,000.
That's a lot.
Okay, so if you take the lowest cost of having a baby, $3,200. Actually, the lowest cost is probably staying at home, but that's something else. We won't talk about that.
Probably not the safest either.
$3,200 to $70,000. So what can a patient do to know? Because if they have the copay, you have a maximum amount, they're going to get cut off.
Can you go to the hospital and find out how much it is and make a U-turn and go to another hospital?
Okay, so why am I bringing this up? Okay, why am I bringing this up? Do you have any idea why I'm bringing this up?
Is it like this for a lot of medicine?
Okay, so a month ago, we did we do it every day, prostate brachytherapy. We've done thousands of cases. We have our own operating room at our place.
We have a data that we follow.
We have our data. We follow all our data because we follow all our patients. So one day last month, let's say, we did a prostate brachytherapy. One day last month, an acquaintance of mine went to a big cancer hospital very close to us.
Right.
Okay? 2 procedures, both done the same way. Person was put a little bit sedated. They were put on a table. Seeds were put in through the skin with ultrasound guidance. They woke up and went home. Okay? One place, they got a bill for $68,000.
Wow, that's a lot.
Okay? And they were expected to pay more than $53,000.
Wow.
Okay?
Yep.
Now, that patient walked in the hospital. They were expecting their seeds to go in at 8 o'clock. Their case didn't take place till 4 o'clock. They were sitting around all day. They couldn't eat. They were walking around in a bathrobe. You know, it's like in a hospital, walking around the corridors, not knowing who's what and who's seeing you and so on.
It's a huge place. You don't feel at home.
And another place, they came in at our place. They came in at 7 o'clock. The doctors were there. The operating room was ready. Anesthesia was ready. The nurses were ready. The physicists were ready. And they immediately went in the operating room, had the procedure, and by 9 o'clock they were home.
Yeah.
Okay, so for the care where Mr. Jones came in and we said, "Hi, Mr. Jones, you're ready to come in," it cost $3,400.
Versus
$3,400. Okay.
Some thousand. Right?
Versus across town, same procedure, same diagnosis. They got the bill for $68,000.
A world of difference.
It's a world of difference, and that's how healthcare is. So you want to save $50,000?
Yeah.
Come to
Radiosurgery, New York.
Come to Radiosurgery, New York. Isn't it incredible? You had the procedure on time. We know who you are. There's not a million miles of corridors. We're not strange faces in a strange world. And you save $50,000. Isn't it incredible?
Yeah.
Wow.
Okay, so why did I talk about baby cost varying tenfold? Because it happens every day, and people often aren't told what it is. But a center like ours offers excellent care, and because of the logistics of medicine, you can save tens of thousands of dollars. So we always want people to have the best care, and we always emphasize the best care first. But here is a double win, triple win. Incredible to save $50,000. So we're having a going out of business sale. No, not going out of business sale. End of the month. No, not end of the month sale. New Year's. No, it's every day. Every day. That's our price. Every day. So you have prostate cancer. You want better results. You have other cancers. You want better results. And consider all the options. All the options. Very interesting, right? So I have another case to talk about today. Here's a gentleman who came in this week. It's a fresh case to us. He is about 70 years old, and he came in pretty angry. He came in like with an attitude, and, I didn't exactly understand it, but he had an attitude. So he had bladder cancer for 13 years. His doctors have been following him for 13 years. So you think if your doctors knows the diagnosis and they're following you, nothing bad can happen, right?
Right.
You'd think that.
You're using surveillance and...
Well, you're being seen. You're being followed. You have a specialist in the field that's following you, right? So his bladder cancer. So for his bladder cancer, he's had lots of local therapy, BCG and other therapy. And he comes to me yesterday with massive cancer in his bladder. So massive that it's blocking both ureters. So we're talking about the tubes, the fallopian tubes before. What's a ureter?
So it connects the kidney to the bladder. And the kidney makes the urine, and it goes down the ureter to the bladder where you hold it.
Right. So the ureter is the highway to go from the kidney to the bladder where it's stored. And then when your bladder's really a big muscle, you push it out into...
Goes to the toilet.
Into the world of the future. So this man had bilateral hydronephrosis. Okay?
Which means?
Both of his ureters were obstructed by the cancer.
It's like a traffic flow where there's a big accident. It can't flow out to the bladder.
Right. So the urine's backing up. And we know when urine backs up, it destroys the kidney. Right? That's what's so dangerous about it.
Sure.
So even though he's followed, so he had nephrostomies. So nephrostomies are openings in the back, little incision in the back, and a tube is put in to drain the urine directly through the skin if they can't do it another way, which is called stenting, to put a stent like a plastic tube in. And because his bladder cancer was so big, they were unable to do the stent, so they did nephrostomies, right?
Correct.
Okay, so he went to a couple doctors at big hospitals, and they said, you need to do radical surgery. You need to remove the prostate and the bladder. The cancer's growing through the bladder into the prostate. You have to say, wow, he's being followed diligently for 13 years, and how did this happen? So that's issue number one, which I didn't even go there. Issue number two, I said, has anyone looked where the cancer is? I mean, you have the surgeons who are proposing this super radical surgery to remove the bladder and the prostate. It means your life is never going to be the same.
The quality of life, you can.
You're never going to urinate the same, and you can imagine what it would do to your sexual function, your urinary function, and maybe
it's a
even
big surgery.
Survival. Right, it's a big surgery. So the first thing I said is, let's find out where the cancer is. Doesn't make sense. I mean, if you don't know where the cancer is, how can you make a recommendation?
Sure.
So you think this is basic knowledge. You think it's Cancer 101, right?
Right.
And it's just like case after case. And these are people going to big hospitals and big doctors, just one after another. So we sent him for a scan, and guess what? His creatinine was up to 1.8, and the nephrostomy on the left side was working. The right side stopped working.
So creatinine it measures the function of your kidneys.
Right. So, and it's not very sensitive because you only need a half of one kidney to have a normal creatinine. So the fact is that he's had impairment of his kidney function, means that this hydronephrosis is destroying his kidneys. And now I found that his nephrostomy is not working on one side.
So he's not draining his urine from one kidney.
And I sent him back to the urologist. He wanted to go back to the same radiologist at this hospital. And the doctor said, well, what do you care? There's some urine coming out on that side. What do you care?
Right.
I said, what do I care? I mean, if he's got hydronephrosis, the whole point of nephrostomy is to drain the urine. And he's got borderline kidney function. The hydronephrosis is damaging or destroying that kidney. It needs to be corrected.
You need the urine coming out. It's not. You don't want to drip or dry.
So I mean, here's the point. I had to push the radiologist to fix something which was not working, and I don't know how a normal patient would ever get the knowledge that the hydronephrosis was back, the nephrostomy wasn't working, and to push the radiologist to correct something that wasn't right.
It's tough.
I mean, that's the whole point of a second opinion. And sometimes people don't understand. A second opinion isn't to go back to your original doctor and say, oh, Dr. Lederman says this, why don't you do this? Well, the doctor's going to say, I already thought of that, it's baloney. No, the idea of a second opinion is to get a fresh second opinion, some different eyes on your case, to know how to best manage your case. And I'm not, of course, always right. You can ask people, they'll tell you I made a mistake, I don't know. But, I mean, wow, you've heard about these cases today. It's one after another case, and people need often a second opinion. So this man, what's he going to have? Number one, he's going to have correction of his nephrostomy. So we're going to fix that tube so that his right kidney is draining the same as the left. We're going to protect that kidney because we want to protect the kidney, because without your kidneys, it's not so easy to live. You can live, but it's not so easy to live. And number two, we talked about all the options for bladder cancer, and one of the options available is actually chemoradiation or radiosurgery, where we focus beams of radiation on the cancer area, avoid harm, and try to avoid radical surgery. And there's actually data out there showing pretty comparable results. Sure. So we want to give this man at least the option of saving his bladder, saving his prostate, saving his quality of life. We want to give him the option of saving his kidney function. And just in one day, we got all that done.
One day.
One day. So, and he changed his attitude. He was really grateful that he came. So went from like very apprehensive, why am I here, to, gosh, I'm so happy that I'm here.
It seems like maybe he had some bad experience, and now it was this was sort of eye-opening in a sense. So
what a difference a day makes.
That's it, day by day. 24
simple hours. And now we've got the man with the Ruby voice.
Ruby
voice.
Moving up in the world.
Ruby voice. We got a notice from the man with the Ruby voice.
Minute by minute, hour by hour.
Here he goes.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. At Radiosurgery New York, the radiosurgery pioneers, that's our goal too. We're first in America, first in